So, Dr. Leung, how do you narrow down your research interest into a research question?
Well, this is a very wonderful question. When I think about the topic, for example, acupressure and depression, it's very broad, okay? And you just ask a general question: will acupressure effectively reducing the depressive symptom? So that's very general. So I have to be very clear and specific regarding what I want to study. I might have multiple sub-research questions under this general question. For example, one of the sub-research questions is that, will acupressure alone affect depressive symptoms? Okay. Secondly, will acupressure in association with Western medication affect depressive symptoms? Thirdly, will acupressure, Western medicine, and herbal medicine, Chinese herbal medicine, all three things together, that will reduce depressive symptom? And finally is that you might want to think about a control group. Control group, that means those clients, they don't receive acupressure. In this case, the control group may just have the Western medicine, okay? While the experimental group will have the Western medicine, acupressure, and herbal medicine, okay? And then you can compare the one who did not receive this herbal medicine as well as acupressure. Are they better? If they are, you bingo. So you might win a Nobel Peace Prize.
Wow. Okay.
Not peace, Nobel Prize, okay? We don't have a Nobel Social Work Prize in social work, okay?
Not yet, that's good to think about.
I hope this will be first category.
So how did you formulate all the research questions? Does it take a long time?
Well, it does take a while because you want to search the literature to find out whether people have done this before, okay? If no one have done this before, then you might want to be very specific in identifying these research questions and research sub-questions. As a result, it will take a while to get those done. Or on the other hand is that the research questions have to be tied into social practice. So don't think about something that is not social work. For example, if I only focus on Western medicine, and then they don't have an MD background, okay? Therefore, when you study this area, it's challenging to tie this in with social work. Therefore, I use counseling, okay? Real counseling, psychological counseling in association with Western medicine, acupressure, and herbal medicine. Now that would be the social work topic. Am I correct?
Right, that's right. So how do you know if a research question is good enough?
Well, you never know, okay? Therefore, when I finish writing up my research question, okay, I think it's good, okay? I think they're good. However, I would share this with my colleagues and ask them to criticize me constructively, okay? So do not ask your friend to criticize you. Ask your non-friends, okay? Ask your enemies to criticize you. Because they will give you honest feedback, okay? If you ask your friend, they're afraid that they will be kind of, they don't want to make friends with you, you say something negatively, okay? But anyway, you may ask someone, not friends, I mean someone who are neutral, who are the leader in this area to give you constructive criticism.
So you have any hypotheses?
Well, if you hear the question the hypothesis should be tied into the question. So one of the hypotheses is that acupressure and Western medicine together will significantly reduce depressive symptom. Okay. Now, when you formulate this hypothesis, you see the verb reduce, okay? Because you give direction there, okay? Either lower or higher. So that's very critical, okay? The second piece I want to say is that you want to make this very simple. Simple is that I say together, okay? Not just one piece, not the other piece, okay? So in this case, that would become a hypothesis. Now, you might have null hypothesis. That means no relationship. So the research hypothesis you just heard earlier, The null hypothesis means that there's no relationship. So I would say there's no significant relationship between the interaction effect between acupressure and psychological counseling and depressive symptom. Okay, so that would be the null hypothesis.
Okay. We are also learning independent variables and dependence variables. So, in your study, what are the independent and dependent variables?
Well, that's a wonderful question. First of all, you might find a definition that the dependent variable is the outcome. Okay, the independent variable or variables are the causes. Okay, so in my case, the dependent variable, you can say, well, I think you have in your mind what it is. That means depressive symptom. Okay, do you reduce or increase? The independent variables, I say plural, is the fact that we have two independent variables. One is acupressure. The other one is psychological counseling. Although I'm looking for the interaction effect. So when you consult with the professor, they will answer your question, what does interaction effect mean? But basically is that you see they interact together, okay? Not single one alone, not acupressure alone, not psychological counseling alone. They have to be worked together. That means you implement both treatment together, okay?
That's great.